We are live.
Okay. Hi, everybody. My name is Haley, and I'm the moderator for our debate. First, I'll start off by introducing all of our group members. First, we have Kristen as the stater.
Hello.
We have Jessica as the pro-prover.
Hello.
Kayla as the con-prover.
Hi.
Greg as the pro-attacker.
Hello.
And Miriam as the con-attacker.
Hi.
The issue we will be debating is the use of punishment-based interventions, and these are among the most controversial treatments for behavior disorders and applied behavior analysis literature. And the controversy concerns both the efficacy and the ethics of punishment, as well as that both researchers and practitioners tend to argue for or against the morality of punishment by developing a position on its efficacy. Some scholars have argued that punishment is unnecessary, claiming that reinforcement-based strategies provide the efficacy of punishment without harmful side effects, making punishment unethical. And alternatively, other scholars have argued that punishment, especially when used in conjunction with reinforcement, has efficacy superior to that of reinforcement alone, making punishment at least sometimes ethical. And in this debate, we will consider the ethical code as well as the literature to argue whether or not the use of punishment is ethical and determine its efficacy. I will now share a visual regarding punishment and reinforcement. Cooper, Heron, and Heward, 2007, defined punishment and reinforcement as punishment is a two-term behavior. Its consequence functional relation defined by its effects on the future frequency of behavior. Punishment has occurred when a response is followed immediately by a stimulus change that decreases the future frequency of similar responses. And reinforcement may be defined as when a type of behavior is followed by reinforcement, there will be an increased future frequency of that behavior. So simply put, punishment decreases the likelihood that a behavior will occur in the future, and reinforcement increases the likelihood that a behavior will occur in the future. Now, Kristen will state the first point of our debate.
Okay, the first point to be made by the pro-punishment side is in regards to literature. Sorry, my dog jumped up. To literature supporting the idea that punishment is an effective procedure in reducing or eliminating maladaptive behavior. Behavior change programs have been found to be more effective when punishment is used in combination with reinforcement procedures. So Jessica, I'm going to hand this off to you and let you begin by proving this point for the pro-punishment side.
The first point that I would like to bring up is that in 1969, Lovaas and Simmons showed that punishment was immediately effective in reducing self-injurious behavior in comparison to just placing students in a room by themselves. The behavior was immediately suppressed and when an electric shock was administered. And when the shock was taken away, the behavior returned, showing the effectiveness of the punishment procedure. Another study by Lovaas in 1987 also showed that 90% of children substantially improved when using the Lovaas method, and over half of these children were able to achieve a normal IQ. Another study done in 2005 by Hanley, Piazza, Fisher, and Maglieri showed that in their study, clients actually preferred treatments when punishment was part of the treatment package. In their study using functional communication training, they used procedures that involved punishment and procedures without punishment, and proved that the procedures that involved punishment were more effective. Also, when their clients were asked to choose which treatment they preferred, one student picked the treatment with punishment 79.3% of the time, and the other picked punishment every time during her last 5 sessions. This also directly relates to the code 4.02 involving clients and treatment. The client should have a say in which treatment they prefer, and this will also make the treatment more successful because the client will be invested in their own treatment. A study done in 1993 by Fisher and colleagues also showed that punishment improved the success rate in client treatment. I will now show a graph showing this improvement. The top graph shows that during baseline, there was a high rate of destructive behavior and a low rate of functional communication. As the functional communication training program was implemented, the communication.
Wait, you should expand it for, sorry to interrupt, but like do it for your whole screen because we could see all of us still.
The background. Is that better?
Yeah, that's better.
Okay. The bottom graph shows that the rate of destructive behavior per hour remained high and variable during functional communication and the use of extinction, but when punishment was introduced with the use of FCT, the rate of destructive behavior immediately dropped.
Wait, Jessica, are you done?
Yes.
Okay. Do you guys want me to transition? Because I had put, like, I kind of did that for myself. Like I wrote my notes and I would say, like, now that Jessica's done, I was going to say, Miriam, what comments do you have about the effectiveness and punishment used in combination with reinforcement? What are your arguments based on the literature that Jessica has proved, or that Jessica has provided? You have to, you're on mute, Miriam.
Is that better?
Yeah. Is that good though? Do you guys want me to do the transitions?
I think that'd be helpful because like what we have written and what she says are going to be two totally different things. So I might not necessarily know when to start talking.
Okay.
I'm not going to do like, because there's like 2 more bullet points about that graph. And I feel like I'm going to be talking for like 10 minutes.
Yeah.
If I say all of it. I mean, I'm going to read through it and make myself more notes.
Yeah.
But if I kept going, that was going to be forever.
Yeah.
Okay. So then condense them as much as you can.
Yeah.
Okay, so then here, Jessica, you're done, and then same thing, I'll say, Miriam, what comments do you have about the effectiveness of punishment used in combination with reinforcement? What are your arguments based on the literature that Jessica has just provided for all of us?
Okay. In the debate, I'll screen share this graph again, but I don't have it saved. So when looking at the results from the Fisher et al. Study of 1993, you can see that in the first graph, the functional communication training did actually decrease destructive behaviors. During baseline, destructive behaviors were high and communication was low, but once functional communication training was introduced, these destructive behaviors dropped and communication increased. You've also said that punishment is successful when combined with reinforcement. Reinforcement, unlike punishment, can be successful on its own. Differential reinforcement is a very useful tool for reinforcing behaviors because it helps decrease the behaviors and also teaches alternative or incompatible behaviors that can be engaged in instead. Cooper, Heron, and Heward, 2007, explained differential reinforcement as being able to reduce behavior utilizing 2 components: providing reinforcement contingent on occurrence of behavior other than problem behavior or problem behavior occurring at a reduced rate, and withholding reinforcement as much as possible for problem behavior. This includes least intrusive interventions and probably accounts for its widespread popularity. It does not involve extended interruptions of ongoing activities like timeouts, contingent removal of positive reinforcements like response costs, or present aversive stimuli like punishment. Differential reinforcement in its various forms is one of the most effective, widely known, and commonly used techniques to reduce problem behavior. Differential reinforcement of incompatible or alternative behaviors has a dual effect. It weakens the problem behavior and also strengthens acceptable behaviors that are incompatible or alternative behaviors to the others. If you're talking, you're muted.
Okay, and then, hold on, let me go to my next one, sorry. Okay, thank you both for your comments reflecting your positions on this matter. Now we're going to allow the punishment side to state their first opinion. The pro side has suggested that punishment can increase the effectiveness of reinforcement procedures when combined. But the con side is stating that when implemented alone, reinforcement is more effective than punishment. Kayla, please provide us with the support for this statement in contrast to the pro-punishment's argument.
Punishment is only shown to be effective in combination with reinforcement. Fisher et al. 1993 showed that functional communication training was effective in reducing some destructive behaviors, but not as efficiently when used with punishment. The study also shows that when using functional communication training and reinforcement procedures, replacement and adaptive behaviors were taught successfully, but punishment could not do this. Ethical Code 4.08 states that a replacement behavior and a way to teach the behavior must be in the plan if using punishment. So punishment shouldn't be used alone, and this code supports the idea that punishment will not be able to teach new replacement behaviors. Wheatley et al. 2009 found the following evidence-based practices are effective when reducing problem behaviors in common areas of schools without utilizing punishment: establishing a common language to communicate behavioral expectations, delivery of specific praise, active participation of school personnel, token reinforcers that are delivered immediately in exchange for other reinforcers later on, and the use of differential reinforcement of incompatible behavior.
Okay, Greg, Kayla has made several points that reinforcement on its own, can you guys see me?
Yeah.
Okay, is on its own is effective without punishment. Can you provide us with support of when punishment should be used?
Well, let's just start off with the fact that Code 4.08, which is part of the ethical standards for BCBA, does state that punishment can be used. Let's also be crystal clear that punishment has one use, and that is to quickly suppress a behavior. This would be the main goal when dealing with major aggressive incidents or self-injurious behavior. Code 4.08 also states that we should use punishment as well as reinforcement at the same time to help individuals learn alternative behaviors. This would be true as no matter whom you are working with, to try and change behavior, we would always want to be looking at alternative behaviors that they could use. The research does not show how reinforcement alone can quickly stop, let's say, a self-injurious behavior. Punishment has been proven to quickly stop a behavior, and then from there, we can start to look at where we go next and the alternative behaviors that we may want to teach the individual. The bigger issue that is around punishment is the fact that people have not been able to replicate it successfully outside of a clinical setting. Lovaas, in his 1987 article, stated that it is unlikely that a therapist or investigator could replace our treatment program for the experimental group without prior extensive theoretical and supervised practical experience in one-to-one behavioral treatment with developmentally disabled clients as described here, and without demonstrated effectiveness in teaching complex behavioral repertoires as in imitation behavior and abstract language. It would be unfair to state that punishment is not as effective as a reinforcer when it has been proven to be effective. The problem arises that in a non-clinical setting, therapists who are not trained correctly or staff who are not trained correctly don't use punishment immediately, consistently, frequency, or with proper intensity. The stigma around punishment has been created due to improper training and is not a result of it being an inadequate treatment model. And I didn't share my picture. I'll share that next time.
Okay. All right. Now that we have heard from both sides, wait. Sorry. Gosh, I lost where I was. Okay. Okay, now we're going to move on to the second pro-punishment argument, pro-punishment opinion. And they're suggesting that in situations where reinforcement has not been found to be effective, it should be allowable. It would not be restrictive if it was beneficial in reducing the negative behaviors such as aggression or self-injurious behaviors. Jessica, what other proof do you have to support the use of punishment? Jess, you're on mute.
Am I unmuted now?
You're unmuted, but did we skip con point 1?
Yeah.
I think we skipped a con point.
the least restrictive measures used first?
I did. Yes, thank you. Sorry.
I was totally freaking out.
Sorry.
What?
Let me just make them big so that, okay. Now I got it.
Oh my God, I'm out of order. I don't know.
No, I'm sorry, that was my fault. Oh, sorry.
You're
Okay.
fine.
Hold on. The least restrictive measures.
Yeah.
All right. Now that we have heard, okay. Now that we have heard from both sides, oh, you guys, wait. No. Okay. Now that we have heard from both sides why punishment is or is not effective, we will move on to our next topic, which will be supported first by the con side. Their argument is in relation to Ethical Code 4.09, which states that the least restrictive procedure must be used first before implementing more restrictive procedure. Kayla, please explain why reinforcement rather than punishment would be the less restrictive option.
According to the Ethical Code 4.09, we should always recommend using least restrictive procedures. Rackman and Teasdale, 1969, indicated that reinforcement procedures should be implemented as part of a regular procedure, and punishment procedures should only be used when other procedures have been unsuccessful. Homer and Peterson, 1980, stated that reinforcement procedures have been proven to be comparably effective as punishment procedures, and positive procedures avoid the unpleasant effects that may occur when using punishment procedures. Reinforcement procedures that have been proven to decrease problem behavior include differential reinforcement of other behavior, differential reinforcement of low rates of behavior, differential reinforcement of alternative behavior, and differential reinforcement of incompatible behavior. These reinforcement procedures are easy to implement and are considered or are constructed on providing positive reinforcement, which avoids any ethical concerns that may arise while using punishment procedures. Wheatley et al. Conducted a study in which they utilized differential reinforcement of incompatible behavior in schools due to a need of low-cost, high-impact strategies to increase appropriate behavior. It taught specific appropriate behaviors, provided opportunities to practice skills, and implemented systems to reward students for behaving appropriately. Can you guys see my graph? Okay. Lost my place. The graph shows that the use of reinforcement strategies has significantly decreased target behaviors that were occurring in school common areas. Common areas are where 50% of target behaviors occur in schools, and these areas include hallways, lunchrooms, playgrounds, bus lines, and buses. The target behaviors included littering, which decreased by 96%, sitting inappropriately, which decreased by 64%, and instances of running, which decreased by 75%. In this study, positive behavior support was implemented to decrease the target behaviors, and it was successful. As I previously stated, multiple evidence-based methods were used to reduce these problem behaviors. They included providing clear expectations and using common language, consistently delivering praise, which is written and verbal, encouraging active supervision, implementing token economies, and utilizing differential reinforcement of incompatible behaviors.
Okay. Brett, Kayla has used code 4.09 to support the use of reinforcement and reject the use of punishment. When would punishment be considered the least restrictive procedure?
Well, why would we want to use a less restrictive procedure if someone is constantly banging their head with great intensity against hard objects? It does not seem to me that using the less restrictive method at this point would make sense. Why would we not immediately look at how we can suppress the behavior and then look at creating that alternative behavior? Personally, I don't want to have the responsibility of explaining to a parent that I am sorry your child has brain damage, but I tried the less restrictive intervention first is not the conversation I personally want to be having. Ethical Code 2.09 states that clients have a right to effective treatment. Therefore, if punishment is the best procedure to start with, then that is what the BCBA should consider first. The BCBA would explain to the parents or the individual, if they are their own guardians, why they are choosing punishment first and provide some of the research behind it. Everyone has a right to treatment, and we should be providing the best treatment possible on a case-by-case basis. An overarching principle throughout life and for a BCBA is to do no harm. The Hippocratic Oath of old states, "I will follow the systems of regimen which, according to my ability and judgment, I consider for the benefit of my patients and abstain from whatever is deleterious and mischievous." There is no BCBA whom is ever going to knowingly place their client in harm's way. The other great part about a punishment procedure is that the procedure is going to be reviewed by a select group of people to make sure there is, one, a justification for why the procedure is going to be in place, the alternative behaviors that are going to be looked at, and that the treating BCBA is attempting to end the use of the procedure at some time. No matter what procedure you use, whether it's punishment or reinforcement, we need to always be looking at how we will stop the procedure so that the added stimuli to the person's life can be discontinued, and we want to allow natural environmental occurrences to meet their needs. The golden book that many BCBAs refer to when discussing behavioral literature, which is referred to as the Cooper book, states that punishment is a legitimate therapeutic technique that is justifiable and commendable when it relieves persons of the greater punishment that result from their own habitual behavior.
Thank you, Greg. The pro side is now suggesting that in situations where reinforcement has not been found to be effective, punishment would be allowable and would not be restrictive if beneficial in reducing the negative behavior such as aggression or self-injurious behaviors. Jessica, what other proof do you have to support the use of punishment?
According to the Ethical Code 4.08, sections B and C, it states that reinforcement procedures should always be used if punishment procedures are necessary. It also states that if the behavior is dangerous enough, immediate aversive procedures can be used. And if the behavior is not dangerous, appropriate steps must be taken in order to implement reinforcement along with the punishment procedures. Code 4.05 also states that you should conduct a risk-benefit analysis to support the benefits of a punishment procedure and to make sure that they outweigh the risks. As cited above, Cooper also states that every client has the right to effective treatment. And if the BCBA fails to use a punishment procedure that research has shown to be effective in the suppression of self-destructive behavior, such as self-injurious behavior, it would be unethical to do so because it could withhold a potentially effective treatment and risks maintaining a dangerous or uncomfortable state for that person.
Miriam, both Greg and Jessica have made great points supporting the use of punishment and stating that it could be used over reinforcement as a first choice in some situations. But please explain to us why you would not automatically choose punishment as a first choice.
Okay, first, Greg, I'd like to go back to something you said. You are correct. Ideally, nobody would want to intentionally put someone in harm's way. But in order to be able to use punishment, we might be doing this unknowingly. Cooper 2007 does say that people have a right to effective treatment, but who is saying that reinforcement is not effective? I would hate to tell parents that we jump straight to a punishment procedure without trying the least restrictive alternative first, for the mere fact that we thought it would end the behavior quickly. We do not know that this will be the case. There are other ways to decrease the behavior without using punishment. Yes, we want to end dangerous behaviors quickly, but reinforcement can also do this. Athens and Vollmer 2010 showed DRA effectiveness without punishment and extinction as possible if you use more immediate, longer duration, or higher quality of reinforcement for appropriate behaviors relative to the reinforcement of the problem behaviors. For example, these severe behaviors like aggression, headbanging, whatever you choose to list here, it's not possible to withhold or delay a reinforcement. It may be possible to manipulate other parameters of that reinforcement, like the duration of it or the quality of it, to favor appropriate behavior. If the function is attention, give minimal attention to the problem behavior, or discuss things in a monotone way in order to get the behavior to stop, and then provide increased attention for the absence of that behavior, and provide like laughing and giggling or tickling and hugs and things of that nature. Intermittent schedules of reinforcement also help maintain this due to the mimic of natural environment training.
Okay, so far we have discussed how punishment can be effective. My computer first. Okay, effective when combined with reinforcement, and how it can be viewed as a least restrictive procedure. The con side has rejected these points, stating that reinforcement alone is more effective than punishment alone, and that punishment procedures should be the default procedure and can be effective in reducing maladaptive behaviors and increasing appropriate ones. Now I'll turn it over to the pro side, which will argue against the inhumane and unethical claims projected at punishment, due to the fact that consent must always be given prior to the use of punishment. If the literature has shown its effectiveness and a client or caregiver has given consent, then it would be unethical to not provide the service. Jessica, please provide support to this statement.
A 2005 study done by Hanley, Piazza, Fisher, and Maglieri demonstrated parents being involved in the use of punishment by allowing the parent to choose what would be used as a punisher and what they thought they would be able to consistently implement at home. This ties directly into Code 2.09, Right to Effective Treatment, because the parent is given the choice of what they think will be the most effective punisher for their child. The Judge Rattenberg Center in Massachusetts also uses a form of shock therapy as a means to decrease or eliminate severe self-injurious behaviors or aggressive behaviors. There are numerous parent testimonials on their website praising the center and the job they do with their children. The parents make the choice to send their children to the center and also give consent to use these methods. The parents state that many of their children would be in a psychiatric facility or heavily sedated, and due to the work of the Judge Rattenberg Center, they are able to be more independent and have been taken off of many of their psychotropic medications. This could also be seen as using the least restrictive approach for treatment due to the fact that the children are no longer heavily sedated and they are not placed in a psychiatric facility.
Miriam, although there have been claims that punishment is inhumane and unethical, Jessica has just provided us with the support to reject these ideas. Please prove to our audience why you believe that punishment is still inhumane and unethical.
Okay, first I would like to start by sharing a video. Is it showing it?
Screams of pain from a student at the Judge Rattenberg Center as he's tied down and shocked for hours. Good evening, I'm Mark Ackerman.
Hi, everybody. I'm Maria Stefanos, Fox Undercover's camera, the only one in court today, as a jury is given its first look at that disturbing video. We want to warn you that the video is tough to watch. Mike Bodette reports.
This is the video that the Judge Rattenberg Center in Canton has fought long and hard to keep from the public eye. The center convinced a judge 8 years ago to seal it, and the battle continued right up until it was played in court, as lawyers for the center asked the judge to bar our camera from recording it. The judge said no, and now for the first time ever, the public can see for itself what these controversial electric shocks look like in use. No, 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 no. Dramatic video of New York teenager Andre McCollins, restrained face down, a helmet on his head, screaming for help. The Judge Rattenberg Center calls it treatment.
I was shocked number 16 or 17. 31 that day.
As McCollins' attorney just described, the teenager was shocked 31 times in all that day in 2002. McCollins is suing the Canton-based center, calling it torture. Lawyers for the center and its clinicians say McCollins needed aversive therapy because he was aggressive.
These are dramatic tapes. There's no questions on that. But the treatment plan at the Rattenberg Center, the treatment plan that Andre had in place on October 25 was followed.
It was an emotional day for McCollins' mother, Cheryl, who was in court as video was played from the beginning of Andre's ordeal, when he was shocked and restrained after refusing to take off his coat.
I never signed up for him to be tortured, terrorized, and abused. I had no idea that they tortured the children in the school.
Cheryl testified what her son was like when she visited him 3 days later.
I couldn't turn Andre's head to the left, to the right. He was just staring straight. I took my hands and I went like this. He didn't blink.
Cheryl McCollins did get Andre to Children's Hospital that day, where he was diagnosed with acute stress response caused by the shocks. The jury also heard her testify about watching the video and hearing staff members laughing while their son was on the floor. We should see more video on Wednesday in court as Cheryl McCollins returns to the witness stand. I'm Mike Bodette for Fox Undercover.
No.
Anyone know how to unscreen share?
Mine was at like the bottom of just my screen that I had. Maybe.
I think I clicked the green button again and it went away.
Is mine still up?
Yeah.
Yeah.
Did it go away?
Yep, you're good.
Okay. So as we see here, the young man is being held down and shocked 31 times to be exact. His mother did not enroll him here, and she says that, well, she did enroll him here and said that she did not sign him up for abuse. Yes, parents can have a say in the treatment of their children, especially if the child has developmental issues and may not be able to make these choices for themselves. But can you honestly say a parent would agree to have their children go through this type of punishment? Yes, this form of punishment may be effective, because as she described her son, he sat still, not moving. Creating a catatonic-like state for someone is not what I would consider a successful procedure to decrease behaviors. As behavior analysts, we have an obligation to do no harm. This is clearly causing harm to the young man. We also have an obligation to respect autonomy and help promote independence. It is important to consider what the subject wants out of treatment as well as what the parent wants. After all, this is to be done to help the subject, not the parent. If the exact treatment was spelled out for the parents and the subjects, I do not believe anybody would sign up for this. Next, we have to benefit others. What about this seen as benefiting anyone? What good is shock going to do these people? We also have to be just. Are you saying that if you engage in a dangerous behavior, you would be okay with someone strapping you down, placing a helmet on your head, and shocking you multiple times while you beg for them to stop? We are to do to others what we would like to happen to us. I know I would personally not enjoy being shocked, no matter what effect it had on my behavior. This goes hand in hand with another ethical obligation we have, treating others with caring and compassion. Is it caring or compassionate to do these things? I would think that finding a least restrictive way to decrease these behaviors would be more caring and compassionate. I would even go so far as to say that the behaviors they are engaging in are sometimes more compassionate because they may not inflict the type of pain that these procedures are causing. I won't go into every ethical code this violates, but these are some of the basic essentials each human being should be ethically obligated to uphold. And the argument that punishment, specifically the Judge Rottenberg Center, is effective and should be allowed due to parent choices seems ridiculous. Rather, I would argue that the use of punishment is inhumane and that reinforcement has been found to be effective in reducing problematic behaviors.
Miriam has just stated for the con side that the use of punishment is inhumane due to the fact that the reinforcement procedures have been found to be effective in increasing adaptive behaviors. She's also pointed out clear examples of violations of codes and principles. She has also provided us with a clear example of how punishment can be severe and potentially harmful. Kayla, what does the literature state about the negative side effects of the use of punishment?
A study done by Homer and Peterson, 1980, stated that punishment procedures have resulted in aggression and unpleasant reactions. The researchers have also indicated that punishment procedures may be subject to inappropriate use and misinterpretation. This may include overusing or forcefully using punishment procedures. In this study done by Fisher et al., 1993, the researchers looked at the effects of using functional communication training and punishment with all of their clients. The researchers found that in one of the cases, aggression aggression and self-interest behavior increased when punishment was implemented alone for disruptive behaviors. However, when punishment was included with functional communication training for disruption, rates of aggression and self-interest behavior stayed low. In this case, the study revealed that functional communication training may have prevented the occurrence of aggression and self-interest behavior by increasing communication. This study has shown that when reinforcement procedures are used alone, they are proven to be effective in decreasing maladaptive behaviors while increasing adaptive behaviors.
Greg, what can you offer to the audience to counter the statements from Miriam and Kayla? These examples have clearly shown that there are some concerns regarding the use of punishment.
Well, I'd like to first just start off by saying that the Judge Rottenberg Center has been brought to court over 8 times, and they have never been brought up for unethical treatment. So while, yes, that video may show some unethical treatment, it doesn't mean that the center as a whole does that, and that it may just be the staff that were causing that. So again, let's discuss Ethical Code 2.09, which states that an individual should have the effective treatment. Why would we not use punishment procedures when they are effective, fast, and may save a child from serious brain damage or injury? We can work on teaching alternative behaviors after the specific behavior of interest has been suppressed and the individual is no longer in danger to themselves or to anybody else that may be around. Places like the Judge Rottenberg Center conduct punishment in a clinical setting with constant oversight from their clinical staff. In that video, I did not see any clinical staff present. Therefore, most likely those staff were acting upon their own volition. It is these punishment procedures that some call inhumane that parents have seen as life-saving. Are we trying to say that in order to save someone's life, we would never consider punishment when it has been proven effective? I would certainly hope not. With that said, parents and BCBA should not be implementing punishment procedures unless they have been properly trained. As has already been previously stated, parents will do almost anything for their children, and when they see that punishment procedures have been effective, where other less restrictive models have failed, and their therapists wanted to avoid punishment, parents are then going to agree that punishment is the therapy that helped their child. Why allow someone to continue to be aggressive or self-injurious when punishment can suppress the behavior right off the bat, change their lives early, and then they can have a better life in the future? Just seems ridiculous to not consider punishment. In closing, I want to make it clear that punishment is a form of treatment, and it is in the ethical codes. And it has been proven to be effective. Punishment's one use is to suppress behavior, and oftentimes it is seen as failing to do, what the hell am I going for here? Oh, punishment's one use is to suppress behavior, and oftentimes it is seen as failing due to improper implementation, not the fact that punishment doesn't work. When punishment is immediate, consistent, frequent, and has sufficient intensity, then it is proven to be effective, and alternative behaviors can be worked on afterwards. Punishment should always be considered when the cost of not implementing the punishment is greater than the cost of implementing the punishment.
Okay, so throughout this debate, we have heard some great points from both the pro and con sides. To conclude, both reinforcement and punishment have been proven to be effective treatments. Both have proven to be effective in reducing maladaptive behavior. Points proved punishment was effective in reducing these behaviors, but also reinforcement with using differential reinforcement of other behavior, differential reinforcement of alternative behavior, incompatible behavior, and low rates of behavior. In addition, both reinforcement and punishment procedures have been able to terminate dangerous behaviors quickly. Punishment is often most successful when combined with another treatment method, and punishment procedures should not be implemented without proper training. A reinforcement or punishment procedure should be selected dependent on the function and severity of the behavior. Lastly, regardless of which procedure is selected, the BCBA who is implementing these procedures must obey the Code of Ethics. In the Code of Ethics, it does state that it is the decision of the client and the client's family in the selection of treatment procedures, but it is It is the BCBA's responsibility to educate these families on both reinforcement and punishment, and which will be the most effective in that client's case. To conclude this debate, we will now have a short question and answer session. Our first question is, how can you help a parent understand the use of punishment procedures as part of their child's treatment plans, and what concerns might come up?
One way to help a parent understand the use of punishment is to make sure that they clearly understand what punishment is. I would first define punishment as a procedure that is used to reduce or eliminate a problematic behavior. I would also want to make sure that they understand that an aversive event is presented after the behavior or a positive stimulus is removed. I would want to make sure that they understand that the aversive event isn't always just taking something away, it can be adding, and that their child will not be in pain or made to be uncomfortable. It could just simply mean that something is being taken away.
Some concerns that might come up when using punishment are parents might automatically assume that the use of punishment is something that will harm the child physically or result in negative psychological side effects. They might assume that the use of punishment procedures causes emotional reactions that may interfere with the child's learning and be unpleasant for the child as well as the people involved in the treatment. Parents might also assume that the use of punishment may cause an increase in aggression from the child. It is important to explain to the parents the broad nature of punishment procedures and that the procedures used will only be implemented after the function of the behavior is determined in order to ensure that unnecessary punishment procedures are used. Punishment results in a decrease in occurrence of a behavior and something that may be added or taken away from the child's environment to do so. Punishment does not automatically mean spanking, yelling, and timeouts. For example, if a behavior is for attention, then timeout is a less restrictive or aversive procedure that can be used. Or if the behavior is escape maintain, then blocking the escape and providing additional work is a punishment that is also less restrictive or aversive. These procedures will likely not result in harmful side effects, and when functional communication or functional assessments are used prior, it will also ensure that the use of punishment is functionally related to the behavior. Also, inform parents that punishment is a short-term solution in order to address an immediate concern with the ultimate goal of reducing the behavior and then teaching an appropriate behavior to replace. But punishment may be necessary to quickly eliminate or reduce the behavior to manageable levels in order for teaching or increasing a new behavior. The parent should always understand that punishment will be used after reinforcement has been tried and been unsuccessful.
Thank you for answering our first question, Kayla and Jessica. Our second question is, it is important to remember that punishment can be negatively reinforcing to the person implementing the punishment. For example, when a parent yells at a child to be quiet and the child quiets down, then the aversive stimuli of the loud child is removed from the parent. If this increases the likelihood of the parent yelling at the child in the future, then yelling is negatively reinforcing to the parent while punishing to the child. Given this dynamic, what strategies can be put in place to help ensure that punishment is not overused or misused?
Well, I would say that the first strategy we can use would be to, one, let the parents know that they are using a punishment procedure, even though they are being negatively reinforced by the child stopping their yelling. They are, in fact, using a punishment procedure. Many parents probably don't understand that it's a punishment procedure and don't see it as a punishment procedure. They probably see it as, hey, my child stopped yelling, this is what worked, and then they will use it in the future. So first, just informing parents would be the best place to start. Once parents have been informed, then we can start to focus on informing the parents about what needs need to be done to figure out the function of the behavior, and then we can start to look at replacement behaviors from there. At this point, we can explain to the parents that, punishment procedures, they really are not teaching any alternative behaviors, and they're not, it's not beneficial for their child. We can explain to parents that if their child doesn't learn the replacement behavior, while they may not exhibit the yelling behavior around them, When the parent's not around to act as the punisher, they'll go right back to yelling. So really, in order to help their child, they should really find the alternative behavior that works and teach that to their child. It's not always about overcoming our immediate challenges, such as the yelling in the moment, but teaching our kids how to be successful as they move into the future. That's all I got. The rest of the stuff I didn't use.
All right, thank you, Greg, for answering that second question. And now we will have a few minutes for Kristen and Miriam to share their personal experiences related to this topic.
So I've seen both the pros and cons of punishment. I have found that punishment has been effective when it's used in combination with functional communication training in order to reduce inappropriate attention-seeking behaviors, and these behaviors typically were aggression and property destruction. And then that was when punishment was used. And what was used was a timeout procedure. And then appropriate attention-seeking behaviors were increased through the use of functional communication and teaching the child to use this communication. So in this case, the parents and the caregivers, they were all on board, and they used the timeout procedure effectively. But the most important thing is that everyone understood when exactly to use the timeout procedures, which was only for the aggression or property destruction. And then when the child was engaging in appropriate behaviors that would be requesting attention from others around them, that they were reinforced at a very high rate. And it was also agreed that we would teach the child how to ask for attention in settings in which even when the problem behavior wasn't occurring. So we would set up these situations so that we could teach the child. So I do believe that when used in combination with reinforcement of an alternative behavior, which addresses the function of maladaptive behavior, punishment can be beneficial because it helps decrease those maladaptive behaviors quickly and effectively, and then we can focus on the reinforcement of the behavior. I have also seen the negative side of punishment, especially I've seen it being overused. And one specific situation would be in schools when the staff may not be as well trained, as Greg has pointed out throughout his debate. A lot of the staff were just assuming, okay, timeout is aversive for anyone, and it's just going to work to reduce this behavior. But what was happening a lot of the time is that it wasn't effective, and they didn't understand why. And I would have to explain that the child was trying to avoid doing work. So if the child's avoiding work, they're using their problem behavior, such as a tantrum, to escape. And if they're placing the child in timeout every time that happens, then it's actually reinforcing the behavior. So I think overall, what's really important when using punishment is that, one, the specific behavior is clearly defined and everyone agrees to the specific behavior. And two, that it's only used for that behavior consistently. And the alternative behavior is increased but through reinforcement.
Okay. And I agree with you, Kristen, that used appropriately, punishment is effective. But I think that a great deal of training needs to go into it, like we've discussed. At multiple clinics that I've worked at, we've been taught how to appropriately restrain children who are engaging in aggressive behaviors, whether it's towards themselves or towards others. And one instance comes to mind every time I think of punishment. We had a little 7-year-old boy who was severely autistic. He could not even speak. He had to sign for everything he wanted. And he often struggled with hunger. And one day he was really upset because he wanted food that we didn't have to give him. And so he started engaging in all sorts of behaviors. He was spitting and screaming and throwing things and hitting himself against the wall. So we went through our procedures, and we were all so quickly worn down because of his high energy that we had to put him in a crisis management room, which is a padded room that has a camera watching him. And the rule to let him out is that he has to be calm for 30 seconds before the door can open. But unfortunately, he was so worked up, he couldn't even remain calm in this room for more than 5 seconds without getting upset again. He struggled to get the food, so he was constantly upset. And so he had gotten himself so worked up in this room that his nose started bleeding. Well, We can't just leave this little boy in this room with his bloody nose, causing a huge mess that we'll have to clean up for safety reasons of others. So we decided to open the door, and I volunteered to hold him as, you know, as least restrictive as I could, while other people got on gloves and cleaned up the blood. Well, this was a bad idea because naturally I'm up against a wall for support since I'm one person holding this child. And I took a face to the lip, and I still have a scar to this day from it. So I just think it's really important that we follow the rules when we use punishment procedures and realize that these situations aren't always going to go as planned. So to always be prepared for these kinds of situations to arise, that way you don't put yourself in more danger by, you know, trying to fix the problem at hand. Thanks for watching.
Yeah, Haley, do you have anything to close with after that?
No, but I can just do a quick little, just like, thanks for watching. Thanks for watching.
Yeah.
Like, oh, we have heard great points from both sides. I don't know, something like that.
Shall I say that now? I'll just.
Or you could.
Something.
You don't have to say it now. We can just add it. You can say something like, "Thank you, everybody, for being part of this debate. Thank you for watching it. We appreciate it."
Yeah.
See ya.
Okay.
All right, do you guys want me to stop broadcasting this and then we'll go back to Google Hangout really quick, or do you want to just keep talking?
Well, how long did it go for?
So we started at it was almost like, we started at 8:57 or 8:58.
Oh my God. Okay, so it wasn't that bad because we stopped in the middle and talked about what we should have done here, and we got lost a couple
And,
times.
I 100% messed up a bunch of times, so.
Yeah.
I feel like some of it really needs to be condensed because it feels like super long-winded.
Yeah.
Like I was like drifting off.
And then the thing is, Mira, maybe we I don't know how much of that video we could cut out, but maybe the video, because the video was kind of long, but.
I thought that too, but every part of it was like super important to our argument. Even if I just cut out like the beginning part where it's introducing it, because even the arguments at the end, like from the mom and from that attorney, were important.
I feel like if we all condense our stuff, even just a little, it'll help.
Yeah.
It kind of felt like we were all just rambling.
Yeah.
And I mean, it's that way too, because we were literally just doing a dry run, reading word for word what we wrote down.
Yeah, can we, well, after this is all done, can you send us, Kristen, the link to the video so that we can go back and watch ourselves?
Yeah.
Yeah.
Here, wait,
I felt like I talked really fast.
Can I stop broadcasting this and then we'll go to another one?
That's good.
Yeah.